Hello, my name is Renata Estes. I'm a women's health nurse practitioner, and today we'll be talking about contraceptive options. So one thing which I want to make sure you all know is that women are different and they have different needs, and hence we have a plethora of contraceptive options available for us these days. One of the things that the way how we look at birth control options is what is the most effective option to prevent an unplanned or unwanted pregnancy. And when we look from that perspective at all options available, what comes to the forefront is long-acting reversible contraceptives. The short name for it is LARCs. The reason why they are excellent and they are the first choice recommended by American College of Gynecologists as well as other organizations is because they are highly, highly effective. And as the name implies, they are long-acting. So the examples of those contraceptives are things such as intrauterine devices or IUDs. Also the Nexplanon implant, which is a very, very short matchstick-like implant that goes under the skin in your arm. The reason why they're long-acting is because once you start using them, the typical duration for these methods is few years. There is another method that is a Depo-Provera shot. It's a shot that you can get every 3 months in the office. It is sort of on the borderline between the long-acting reversible contraceptives and the rest of the contraceptives. It does not work for years because you do have to come in every 3 months and get a shot every 3 months. But at the same time, you don't have to remember about taking anything or doing anything every single day. The long-acting reversible contraceptives also have additional benefit, which is none of them have estrogen as a hormone. So there's only one hormone in them, and that is progestin. There is also one non-hormonal IUD, intrauterine device, which is the copper IUD Paragard. That one is actually working for about 10 to 12 years. Once a long-acting reversible contraceptive is used, you obviously do not have to keep it for the duration of time as it is for which it is recommended. You can take it out or remove it or have it removed anytime you wish to do that. So many times women will use these methods to space out their pregnancies in between 2 different pregnancies. On the other hand, you also have sometimes what seems to be very convenient, which are birth control pills, oral contraceptives. And once again, these can be divided into 2 subcategories. One is combined oral contraceptive. As the name implies, it does have 2 hormones. It has progestin, which is the main hormone that provides the contraceptive benefit, and it also has an estrogen added to it. The other category are progestin-only pills. They're called also mini pills. They're not as effective as the combined oral contraceptives, and they're definitely not as effective as the long-acting reversible contraceptives. The combined oral contraceptives are effective as effective as the user who is actually using them. So in essence, as good as you are using them, that's where the effectiveness comes from. If you forget, if you skip, if you don't take your pill every day, then the efficacy or effectiveness of the method goes down. These methods are not as effective even with perfect use as the long-acting reversible contraceptive, which brings us once again to the recommendation that if you're going to consider birth control, consider the long-acting reversible contraceptive. Because women have different needs and different acceptance factors, and they warm up to one method versus the other, we have a variety of options. So our job is to sit down with you and explain all the options to you and help you decide what is the best option for you. There are also barrier methods. Those are things such as diaphragms, condoms. Diaphragms are not used these days very frequently, but there's also a female condom. There are male condoms. Those methods are readily available over the counter. They're highly encouraged for prevention of sexually transmitted infections. But once again, their effectiveness rate in prevention of pregnancy is not as good as the combined oral contraceptives, progestin-only pill, or the long-acting reversible contraceptives. If you have any desire to discuss these issues further, please come and visit us in our office. We'll be happy to sit down with you for consultation and just explain how these methods work and what is the best option that you can choose for yourself.